it was the last thing I said to them, and you had said that only 6% of U.S. citizens will admit to having participated in genetic testing. So,
and it's true, like there's so many people walking around out here who don't know about their family history, don't know genetic testing even exists. So if they haven't done this, they could have CHEK2 mutations as well and never know this information.
I really hope that people realize that, knowing this information, while yes, can be a little bit scary, can be really helpful in knowing what screenings we can offer someone so that we can hopefully catch something early or even prevent cancer from occurring. My name is Morgan Gutierrez. I'm an oncology genetic counselor here at Houston Methodist Willowbrook. I've been here for a little bit over 2 years. A genetic counselor is a medical professional who helps patients and their families go through genetic testing and interpret those results. So talking about all the implications that it might have for their own cancer screenings as well as their family. It is a very small field. It is continuing to grow as more and more people are hearing about it and just as our knowledge of genetics is growing. With our expanding field of genetics, there's going to be more and more genetic counselors that we need to help test these patients and deliver those results to them. Commonly, when I get a new referral, before I see the patient, I will look in their chart to see what family history or personal history of cancer is already listed. And from that, I start drawing what's called a pedigree or a family tree. So we're able to draw out that family tree and note any cancers or any other factors that would be helpful for us during our risk assessment. So I usually start that before I see the patient so that when I go into the consult room, I have somewhat of an understanding of why they're coming in to see me. And then as I sit with the patient, I am kind of filling in those gaps and writing in any other cancer history that may be helpful for us to know. Today, I have some patients who were referred by PCPs or OBGYNs for a family history of cancer. So we would consider them to be at a higher risk. And so I'll talk to them a little bit about the option for genetic testing, any future screenings or family implications.
A lot of times it's just testing one parent and then testing kids, but this situation was unique in which we needed to test both of you guys to have that full picture for your kids.
Right.
So thankfully, no BRCA mutations or anything else. We can just kind of focus on that CHEK2 mutation.
So CHEK2 is actually a gene that we all have. We have 2 copies of it, one that we got from our moms and one we got from our dad. This gene is supposed to be helping protect us from developing cancer. But if there's a mutation or a typo in that gene, it can't work quite as well to protect us from cancer. But really our management and our guidelines show that we should do increased breast screening and sometimes increased colon cancer screening as well.
This patient, she's newly diagnosed breast cancer.
Okay.
Because she's the one that will need the surgery.
Okay.
So
we'll need to do it quickly. I think especially in cancer genetics, a lot of people get very fearful of knowing this kind of information. But really, if someone has a genetic mutation, it is something that they were born with, that they have had their entire life. Having a mutation does not guarantee that someone is going to develop cancer. Dr. Wing wants to order genetic testing on this patient. Told her I would get the kit ready, and I can always call the patient. I mostly work with our medical oncologists. They are the ones seeing our cancer patients for their visits, and so we work very closely. They let me know when patients may qualify for genetic testing, and I also let them know by reviewing their clinic schedules every day. So I work very closely with them as well as their nurses and medical assistants. I think our clinic does a really good job of working as a team to put our patients first. Hi Annie, this is Morgan, the genetic counselor from Houston Methodist. I just wanted to give you a call and talk a little bit about your genetic testing results. Is now a good time to talk? So these are the kits that we use for the genetic testing. So we draw the patient's blood and then send it off to a commercial laboratory. On these cards is my patient's consent for me sending their blood. So I'm just filling out the card here with all their information so that when it gets to the lab, they know whose blood this is and can connect it to the orders that I place online. Have you talked more to your daughter about being a genetic counselor?
Yeah, she loved it. She wanted to do that. Yeah, she's in high school right now.
Yeah.
But yeah, she's very interested in that.
Yeah. So here at Houston Methodist Willowbrook, we partner with local high schools to bring in some of their students who are interested in the healthcare field. And so a few of us get to kind of speak about what we do. And I'm really excited to get to do that, and getting to share that with them when they're trying to explore all these different career paths is really awesome. And I hope that it sparks some interest in them so that we have more future genetic counselors. I went into oncology genetic counseling because I really like having actionable steps to help patients and their families hopefully prevent or catch cancer early. In cancer genetics, we get to focus on our patient, but also their whole family, as these results can have implications for them as well.